So yesterday, we had the former chair of the Health Board of Prince Edward Island come and speak to the Standing Committee on Health and Social Development. And we heard much the same as we heard from the CEO of Health PEI and what we've heard from the unions, what we've heard from frontline healthcare workers. And what I've been saying, there is too much involvement from politicians into the healthcare system. And the only way that we're going to resolve that is if we ensure that everybody knows what their job is, and then they stay in their lane, because that's what's creating chaos in our healthcare system. When there are no rules, you have chaos. So what we heard from Derek Key was the implementation of the incentive, the retention bonus that went out in October. He was never consulted, and if he had been consulted, he would have said it's not a good idea and they don't support it. That's much what the CEO of Health PEI said. And then the unions, on the day of, even told the Premier that it wasn't a good idea, it wasn't going to go over well, and the Premier continued to do it. So here's the problem. The Premier should never have been involved in what healthcare workers get paid or what their incentive bonuses were going to be. That is the operations of our healthcare system. That would have been the role of the CEO of Health PEI to determine who got the bonus and who didn't. Instead, the Premier chose who was going to get those bonuses and caused division throughout the entire healthcare workforce. That is no way to improve healthcare in this province, which is exactly what Health PEI and the board have been trying to do. They've been trying to create a better environment within the healthcare system. We need our healthcare workers to be valued. We need them to feel appreciated, and you do that by giving them vacation, and you do that by paying them. So we should have seen a budget come forward for retention, and then the board and the CEO should have decided how that was going to be spent, and then the board should have held the CEO of Health PEI accountable to ensure that that's what happened. Instead, the Premier decided that he's the CEO of Health PEI and he knows better than the people that actually work in the system. This is something that has been going on for decades. Government over government has thought that they know how to run healthcare better. And now when you look at what it looks like today, I think every Islander will tell you that healthcare has declined dramatically, especially in the last 4 years. Our premiers have been obsessed with interfering with the healthcare system. We have the Liberal leader now saying that she's going to be the healthcare minister if she becomes premier. We basically have a premier who is already the healthcare minister because he seems to be the only one working on the file. And it's not working. So when are we going to understand that when it's not working, we have to change it and we have to do it better? And the legislation is there. The accountability framework is only half done. That's the minister's job, and he's not even doing his own job. At the end of the day, the healthcare system is the way that it is because the people who are in the roles have not done their job. And so I am calling on Premier King and the Minister of Health to get themselves out of the day-to-day operations of healthcare so that the people who know what is going on in the system can actually do the work that needs to be done with frontline healthcare staff. And then you put them in that role, you hold them accountable. That's what we need to do.